I come out on the phone and watching television and they say, "Who's that, Keith?" I say, "I don't know. I've just forgot that, you know." Or like they'll say, "What you had for your dinner, Keith?" Dinner? I say, "I don't know. I don't know." And it's all right. It comes back to me now, you know.
Keith started to get him memory problems about 3 years ago. He wasn't remembering to do things. Keith used always to do the shoes Fridays. He forgot to do them, but he still does them, but only when I prompt him. He forgets to shave. He comes downstairs with his collar out and his shirt lap out and looking a bit dishevelled, as if nobody cares about him. When we're watching Flog It on the television, Keith watches it really well, but if I have to go out of the room and say, "How much did that vase fetch?" he'll say, "I don't know, can't remember." So I don't know how much of all these programmes he watches he's actually taken in.
I've been forgetting quite a bit lately, you know, because at one time I thought, thought it would be like, you know, forget, lose my memory, it'd be like. But it's been coming on quite a while, like, you know, not completely, you know, but little things like, you know, like somebody ringing up on the phone and Gene will say, "Where's, what was that like on the phone?" I don't know, I've just been watching it.
He knows he's forgetful and he doesn't like it because I think he's bothered about what other people think. I have to think for two of us instead of just myself. And I try to do the best I can and just help him along the way, although he does get a little bit ratty. He's always was bright as a button, always laughing and joking and whatnot, but if you tell him too much or remind him too much, he gets a bit what I call shirty. I worry about how far it's going to go, obviously. He goes into himself, he'll sit there and I'll say, "What are you doing, you? What are you thinking about?" And, you know, he'll say, "Oh, I'm just a bit down today," which is not the usual thing with Keith at all.
It's nice to look back in olden times, sort of thing. Because a lot of people wouldn't know the new ones thing, how they dress and how they do it, don't they? It's nice to go back, nice.
I would encourage people to support because they need to know more. Over the years now, there's going to be more and more people who are starting being forgetful and carrying on, as we all know how they become. And you need as much money as you can, really.
The work from the Dementia Appeal will really enhance the care we give to dementia patients. The Memory Corridor will help overall for the patients to reflect on their past times, and the colour coordination will help them find their way around the ward.
The Blue Skies Peace of Mind Dementia Appeal is something myself and the fundraising team are very excited about. It will give our staff on the Fylde Coast a better environment to treat their patients who are living with some kind of memory loss, from people like Keith who are only experience mild memory problems to others who are in the full throes of dementia. The money raised will be spent on creating a memory corridor so that patients can reflect on their childhoods and their time growing up on the Fylde Coast, on making our hospital sites easier to navigate for people living with memory loss, and on building a secure interactive garden at Clifton Hospital. I ask the people of Blackpool, Fylde and Wyre to really get behind this campaign. Please help us to raise £30,000 for dementia care in this area. We're thrilled to have the support of high-profile figures such as Jimmy Armfield and of organisations such as Age UK in Blackpool and in Lancashire. Organisations who fully understand the impact of dementia on people's everyday lives. Not faceless people, but people like me and you who are someone's family, someone's friends and someone's neighbours. This is why we need our peace of mind appeal. Dementia is becoming more and more common as we see an increase in the ageing population. It's something which has the potential to affect everybody, and that's why it's so important that the Blue Skies Hospitals Fund supports Blackpool Teaching Hospital's NHS Foundation Trust in caring for people with dementia. Blue Skies Hospital Fund has created this appeal, but it's truly owned by everybody who lives in Blackpool, Fylde and Wyre, whether they've got experience of dementia or not. No one knows what's around the next corner. And ensuring we can help those who live with dementia to live well rather than suffer from it should be a priority for us all.